So the issue of standing consent. So this is, a bit contentious, but this is the way it's running. The My Health Record operates on the principle of standing consent. So if a person has a My Health Record, they are consenting to you to have a look at it and to upload information to it, provided you are involved in their healthcare. That's the proviso. So other people, such as, there's been a bit of publicity about the police being able to access it, or employers being able to access it. Well, that's not the case. They have to be involved in the healthcare provision of that patient to be able to access their My Health Record. Now, where it gets a little blurry is where you might work for a healthcare provider organisation and they theoretically could have access to it. Say the HR department in a hospital maybe look at the My Health Record of one of their employees. Well, that's actually a breach of the legislation because they're not actually involved in the healthcare of that patient. Right? So there are pretty strict controls and legislation about it, and we'll go through that in a little while. So what can consumers, patients, as a summary, they can choose to have or not to have a record. They can direct healthcare providers to not upload information. They can remove documents from view. They can restrict access to particular documents. So the actual controls are really quite nifty, but you've got to know about them to get into it. So if you, as a consumer, had a document that you thought, look, I don't want anyone to look at that unless I give them a code, you can label that document with a code that no one can look at it unless you give them the actual code to look at it. Likewise, you can have the whole record blocked so that nobody can look at it unless, if it's my record and I own it, if I go and see somebody, I could say, I don't want anyone to look at my record unless I'm there and I give them the special passcode. Then they can look at my record. So there's all these levels of sort of security and access controls that people aren't being terribly well informed about. There's also a very good audit trail. You can see who has accessed your record. And one of the things I've done with my record, which I've demonstrated at a number of sessions like this, but I'm not going to tonight, but if I was to go in and look at my record using one of you guys, using your practice system, it would send me a message on my phone, it texts me to say somebody's looking at your record. I think that's pretty cool. So you get real-time information on your phone to say somebody's looking at your record for the first time. After that, it only notifies you the first time. But if, the other medical practice in Bacchus Marsh where I work, if I get a text to say they're looking at my record, I'm going to be pretty annoyed. And if I report those people to the provider of the system, they will be investigated, and theoretically there's very hefty fines, potential jail terms. It's don't go snooping is all my advice. You can't really anyway, because the patient has to be a patient of your practice, and again, as we said, you have to be involved in their healthcare. And the patient, the person you're looking at, there's an audit trail. They can see who's accessed it. Consumer or patient access, how do they access the My Health Record? Well, you can go through the website, through their computers and iPads and that sort of thing, through the MyGov website, or they can use one of these apps that are linked, and the apps are download and read only. They can't do anything other than read it. So you've got Health Engine, the one on the top left. Then you've got Healthy, Healthi, Tide, Tyde, My Child's eHealth Record, and Health Now. These have all been developed by third-party developers, except for the children's one that's been developed by the Digital Health Agency. The others have been developed by third-party organisations, and they have access and go through the strict access protocols. So that means that patients can view their information on their phone without having to go through the website. Or they can choose to go through the website, through MyGov. Now, this is a contentious one too. This is an area we know is problematic. How do we deal with minors? And there was a submission made by the College of GPs to the Senate inquiry last week as well about that, making some recommended changes. So at the moment, the way it is when the baby's born, a My Health Record is automatically created after the opt-out period. And unless the parents choose not to have one, and they can choose that the baby won't have one. Between 0 to 14 years of age, after this opt-out period that we're going through, all children will have a My Health Record created for them unless their parent or guardian instructs the government not to create one. For children aged up to 14 years old, a parent or guardian controls their My Health Record and makes decisions about access for healthcare organisations. The parent guardian can view the child's Medicare benefits scheme information, pharmaceutical benefits scheme information, the immunisation register, until the child turns 14. Then those feeds are turned off completely. So most of us are going to access it through clinical software. Best Practice, Medical Director, ZMed, Genie, whatever clinical information system or software you use. And in that, you can view information, you can download information in any of the formats that are up there directly into your system, and you can upload information, like we said, the shared health summary and the event summaries. There is also a provider portal, which means you can access it through a web browser, basically through the internet. But that is still under the auspices of your practice, and you have to nominate your practice to show that so that the system knows that it's you and which practice you're under which practice you're accessing it. And so with the provider portal, you can view information, you can download in the format of PDFs only, but you can't upload any information. So most of us, I would say, and the provider portal, at meetings we've been at about this, there are very, very few doctors accessing through the provider portal, like 100, something like that. But everybody else is accessing it or able to access it through their clinical software, whatever you're using in your practice. If you can't access it, you need to speak to our friends at the PHN up here about how to set that up so that you can access it, because it's not easy. It is technical, and there are a few hoops, legal hoops that you have to go through, and you have to jump over various hurdles, sign off lots of documents, and then you have access. Once you've got access, it's actually fairly easy and fairly quick. But it does depend on how good your system is, how up-to-date your clinical software is, and how fast your internet connection is.